With the U.S. Supreme Court validating the Affordable Care Act recently, many states are moving forward with implementation on the state level. Hi, I'm Steve Swat for Comcast Newsmakers. Joining me to talk about this is an individual who's right in the middle in California, Dr. Richard Pan, a member of the State Assembly from Sacramento. Thanks very much for being with us.
Thank you. Thank you for having me here.
You're the chair of the Assembly Health Committee. You are a medical provider, a physician. How is California going to be ready?
Well, California, we're certainly working very hard to be ready for implementation of the Affordable Care Act. This is a very important step forward to expanding access to health care for Californians, as well as trying to maintain our quality and bend the cost curve that we need to do here in the state.
Now, I know the state is in the process of starting the exchange, the so-called exchange. Explain exactly how that works, especially for our viewers out who may be watching who are not insured right now.
Sure. Well, the exchange basically creates a marketplace for particularly small businesses and people who are looking to buy insurance on their own. So people who are in large companies or work for large entities, their insurance coverage probably isn't going to change. The exchange really helps stabilizes that market. And it's like going to a online store. You'll have a set of different plans that are available. You can pick between different health plans, but actually packages are going to be standardized, so it makes it easier to compare apples to apples and oranges to oranges. It will be able to be done online, and so this is something that's really going to allow plans to compete in a way that people who are looking to buy insurance can pick the best possible plan for themselves and their families.
Correct me if I'm wrong. Are we looking at about 2 million Californians who will go on the insurance rolls?
We are looking at approximately that many. There may also be people coming on board because of expansion of our Medi-Cal program and other parts of the Affordable Care Act. Again, expanding coverage to many more Californians in our state.
We've heard reports, I think Congressional Budget Office may have mentioned this also, of a doctor shortage. In other words, not enough medical providers to take care of all the influx of individuals who will be insured now. Is that
certainly,
you?
Yes, that is a concern, and I think we need to recognize that the conditions and the diseases people have don't just go away when we don't provide them care. So they're out there in the community. The Affordable Care Act will allow us to be sure that those people have coverage to get their problems taken care of. We're going to have to deal with the challenge of shortage of healthcare professionals. And I think I've been looking at, and people have been looking at, different innovations we have in terms of both technology and care delivery systems to better take care of this larger population and to do it in a high quality way.
I know you're working on this issue really on the ground in California, but if you look at it in a large picture, depending on how the November election turns out, if Governor Romney is successful and Republicans hold on to, let's say, both houses, hold on to the Congress and win the Senate, there will be an attempt perhaps to repeal, maybe save some portions of the Affordable Care Act, but repeal the exchange, for example. Is that even feasible, do you think?
Well, what I would say, it's interesting that in the beginning of the presidential campaign, he talked about total repeal. Now the Republicans are recognizing that actually when you talk about the specific provisions of the Affordable Care Act, of federal health reform, they are actually popular. And now they're talking about partial repeal. So I think when we come after November, the Affordable Care Act will still be here. There may be changes at the federal level. I certainly hope and expect President Obama to win. But I think that the state of California is committed to move forward because we do need to move forward on health reform. We actually tried it at the state before the federal government tried. We didn't quite do it then, but certainly we are going to move forward on what the federal government has proposed.
All right, Dr. Richard Pan, thanks for coming by and talking about this important issue. We appreciate it.
You're welcome.
And thanks to our viewers for watching Comcast Newsmakers from the APAPA Voter Education Forum at Sacramento State. I'm Steve Swat. We'll see you next time.